Well, hello everyone, and welcome back to the medical equipment world and healthcare get the scoop. The podcast where we break down durable medical equipment, patient care, and real world solutions for caregivers, families, and healthcare professionals, and anyone who else wants to listen in. I am your host. I am Tara, and I'm a certified medical equipment specialist. And Silas is here today too. And we are with CFS Medical Supplies and Equipment, CFS Solutions. And whether you're new to DME or a seasoned provider, this show is here to give you insight, tools, and stories that matter. A quick disclaimer: the information shared in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult with your professional healthcare doctor or your personal physician regarding any medical decision or concerns. Neither the host nor guest assume liability for actions taken based on content discussed in this episode. And you guys always know I say in any other episode. So welcome back today, you guys. I am excited to be back on. It's like we've been like really busy, so we like trying to jump in when we can to get these interviews done, to just kind of share information to with families and whomever who can take something from our conversations and just make things just a little bit easier for you. So we hope that these episodes and this podcast has done that, and it continues to do that. We are a growing podcast, and we're totally excited because every week we get these reports, and it's like, oh my gosh, like it's really interesting, and it just lets us know we're heading in the right direction with trying to give information and resources to families. And so I just wanted to chime in and say that. So, Silas, did you have something that you wanted to say real quick?
Yeah, so I'm excited for this particular episode. In this episode, I'm really excited about the topic. It's a huge topic, really talking about hospital beds and what's out there, primarily because we know that a lot of those out there who, they're kind of just trying to figure things out. And a lot of times when you need products like this, things are just moving very fast and it's not really talked about. So this is going to be a very informative episode.
Yes, we were excited about it. One of the things that, we always get questions about beds. Beds is a huge topic. And of course, when you think about it, you're like, well, I guess it is a huge topic because you see it advertised a lot about beds, whether that's a regular lifestyle bed, as a mattress. There's a lot of advertising going on about beds. But understanding the proper bed for your loved one, depending on what situation they're in, and also what situation you're in. And so we just decided to, like, you know what, let's keep trying to talk about this so people can understand, and hopefully that it will kind of help with some of the mistakes that we see constantly when people purchase these beds. And so our topic today is called the bed insurance covers versus what patients actually need. So this is going to be a great topic. So, the thing of it is we help families understand that the standard bed insurance covers is often a straight starting point, but it is not always what's truly needed. And we see that a lot. So we'll get families to say, we received this bed, and they call it the brown bed. And we received it and we don't like it. Now, again, it just depends on what's going on with you, and it goes with what's going on with your loved one, because a lot of times we find that if you have something going on where you need a lot of you an example, if you have multiple caregivers, or you may have one or two caregivers, you have to be positioned a certain way, you need to be turned, your loved one may need to be turned, all these different things, there's different things that go into it, right? But if you just had maybe go knee surgery or something basic, or you might have a long-term situation going on, but you don't really need any of the things that about positioning and Trendelenburg and being able to clinical contour and comfort. Maybe you don't need any of that, right? Because we've seen that too. We've seen some beds people have and the brown one works perfectly. It's fine for them. But then we see a lot that it does not. And unfortunately, it has been very stressful for families to try to take care of their loved one when they have limited type of equipment. And so I always like to use data. I'm a data girl. I like to talk about data, right? So we'll just tell you like 1 in 5 U.S. adults and caregivers is a caregiver. And caregiver health is meaningfully affected by the demand of care. So we kind of already know that, right? And so what Silas is going to share today, he's going to actually show you guys the differences of the beds that normally, what the insurance normally covers, what's usually brought out, and then the ones that really we've seen firsthand that really has made a difference depending on what's going on with the patient. Okay. And so, Silas, I'm going to go ahead and let you take it over here and just kind of share with us some of the information you have, some of the data you have, so that families can actually see and understand the differences with the beds and what they do.
Yeah, so first, I want to talk about the primary beds that you normally would get through insurance, right? So with the insurance, normally you're going to only get a just kind of like what you were talking about, the basic brown bed, which is essentially just a standard, it's a standard platform where it elevates the head and the leg, and you would actually have to crank the frame of the bed. So if you wanted to adjust the height of the frame off the floor, you actually have to turn the crank at the foot of the bed, right? And so with that, a lot of times, a lot of families complain that that is not, it's very kind of strenuous, right? It's strenuous on the caregivers if you have them, or even if the family member is a caregiver, that becomes a huge bottleneck, right? Long term. Now, of course, the beds are good, I always say the beds are good for those who are dealing with some temporary situations, right? Just recovering from a surgery, hip surgery, neck surgery, things like that are very simple, but they have most of their mobility and they're pretty much going to be out the bed for, they're going to be out the bed like within a month to 3 months, maybe 3 months max. And even in that duration of time, they're not in the bed consistently all day, right? There's a lot of breaks from the bed. They're probably sleeping in it all night just to be in a certain elevated position. And then throughout the day, they may spend maybe an hour or two just for elevation purposes, but they're in and out a lot.
Yes.
So that's why I would say with the basic brown bed, that's covered through the insurance. Now, the beds that we're going to really dive deeper into is the beds that are not covered by insurance, right? And that this is where the disconnect happens because a lot of times, when you call the insurance, they say, okay, I'm looking for this level of bed here. A lot of times, even on the insurance side, they will say, yes, we do cover it categorically, right? On a category side, yeah, hospital beds are covered, but the key is what kind of hospital bed is covered. That's the huge difference that we want to talk about today is the kind, right? The ones that are covered and the ones that are not, and what's the differences, right? So now, of course, like I said, if you're someone out there and you know that you're going to be dealing with something very temporary, then yeah, going through insurance may be good. But the only caveat though is that the insurance does take time. So it's definitely not like in pharmacy where the doctor writes a prescription and you're able to get the medication either the same day or the next day. A lot of times with the insurance, there's a lot of documentation that has to go through. There's a couple obstacles on the paperwork side that has to go through before the insurance approves a hospital bed, especially. And then another thing too, always tell clients out there is that a lot of times people complain that when they do get their hospital bed, a lot of times it's old, it's, kind of run down, so it's not delivering the amount of care that it used to because it's an older machine. And I will contribute that to the reimbursement rates are, there's kind of really a disconnect. You can kind of talk about that too on the insurance side about the reimbursement rates of that. That's actually the real reason why when you receive a bed through insurance, most likely, well, number one, it's always going to be a used bed, most likely. And number two, it's most likely going to be old because of those reimbursement rates. So what's happening is that the cost of the bed brand new is going up, but the reimbursement rates with insurance is going down. So the vendors can't really provide that level of care because it's not being covered.
Right. So great outline, Silas, there. And I'll chime in to say, like, when it comes to the semi-electric bed that the insurance covers, that it is a semi. However, some providers will provide you what's called an upgraded bed. You would just have to ask them about that through the insurance, but you would have to pay out of pocket for that. And when we talk about it will be a full electric, And what the difference with that is instead of you having to crank the frame of the bed for the high-low point of that, you can actually use the remote control to do that, right? Okay, so basically the remote control is going to help raise the frame up and down versus someone having to crank it. But because the bed only goes so far low and so far up high, it's still a lot of times not enough for a particular situation that a caregiver is dealing with a patient, right? Or your family member. And so that's the what we see, and that's the challenge, right? So when you talk about reimbursement, the reimbursement rate for a semi-electric bed is around $74. I think it's $74. And my billing team does the billing, and so of course I look at it and all that stuff. But sometimes every 3 months it could fluctuate and go up. A lot of times it kind of go up a little bit, a couple of dollars. But last thing I checked, I think it's like $74, right, per month, and that's for like 3 months. And then after the third month, it drops to around $50. And then, of course, now it depends. We're in California, so it depends on where you are. If you're in a rural area or just different states, there's different amounts. But ideally, it's still on the amounts. They're kind of around the same amount. So basically, my point to that is you're looking at possibly maybe under $100 a month for the first 3 months. Well, for the first 3 months, then after that, it goes down even lower. So a lot of times we have patients like, oh my God, like why is this, why does someone send me something like this? Not us or a company they've dealt with that they're dealing with who gave it to them through insurance, because we don't bill the insurance for beds at this time. So basically what they're saying is we got this, we don't want it, and why would they bring me this? And so we have to explain to them, like, I'm sure it's not that they just wanted to give that to you, but unfortunately the reimbursement rate doesn't allow people to bring out brand new beds. And of course, like they're like complaining because they're saying the mattress is bottoming out. It feels like my mom is sleeping on the frame and all these things. So we've heard it all. And so that's why we wanted to get on here and just show you guys the differences so that you will know what the differences are. Because a lot of times, I've even had families to say, what are they bringing me? Like, how, what does it look like? What is it? And sometimes you have to explain that. So hopefully someone can take away from this video, in this episode, and see exactly what the bed is and what the differences are and the functionalities of them. Okay. So talking about the data, National Alliance of Caregivers reports that 4 in 10 caregivers are in high burden situations. Listen to that. 4 in 10 caregivers are in high burden situations, with burdens rising as caregivers' hours increase. As we know, and we say this all the time, 10,000 people every day is turning 65. And so we know that there is a huge need for caretaking as we all age and get older. And we also know that there's a lot of facilities that have waiting lists sometimes, because that's just how critical the healthcare system is and people needing care. And so it becomes a risk factor there when you need to take care of someone, or someone needs to be taken care of, and they are don't have the right equipment. And that's normally what we see when someone says, what is your ideal situation? And we'll talk about that. We're actually going to be showing that in a couple of days, what an ideal situation is that we see when we take it into a home, and how it produces and performs and make things easier for a family. Okay. And so then we'll go and talk about the data mentioned. Talked about some data earlier. I'll give you some more data. Talked about the CDC reports that 1 in 5 U.S. adults are caregivers, right? So that's a lot of people. That's a lot of caregiving going on, right? And just to think that what we're using to take care of our loved ones, sometimes it's not sufficient for what we need to do. Okay, so that's one. So Silas, we're gonna go ahead and okay, and this is another thing I wanted to share with you guys too. Talking about the deck. When we talk about the bed and the frame, and how critical and important it is to make sure that whatever bed you choose to get, it has a proper deck and frame. What we see sometimes is families purchasing, because you don't know what you don't know, right? But purchasing beds because it may even have a high low component to it in the functions. But is the deck considered what we call medical grade? Is it efficient to put a low air loss mattress on that deck if you needed to? Okay, so those are questions you have to ask. I have a family now actually that purchased a bed. It goes up, it goes down, it even elevates, the frame even elevates high. It gets very high. But the frame itself is is smaller than the standard low air loss, which is 36 inches plus. So it's smaller than that. And then come to find out the frame itself is not even conducive to even put a low air loss mattress on it. So now that family has to either just keep what they have and continue to be probably possibly with their loved one with wounds, or buy a whole new bed and a new low air loss mattress. Yeah, those are the things that we see constantly. And those are the things that's very painful because you when you know these things, you're like, oh my God, like I really wish they would have known because now they got to go spend more money. And I don't know about you guys, I'm frugal. I try to budget, and I just believe that when people have knowledge, it allows them to be able to make better choices. And so again, why we're doing these is because we hope that people can hear it, see it, and pause before they start purchasing things, especially online. Especially online, anyone can sell you a product. They can tell you how the specs are, but is it conducive to what your loved one has going on? There's a lot of variables that go into this. We look at the full picture, not just the specs, looking at what's going on clinically with the patient, what could possibly progress with the patient later on, and making sure that that family has something that we called, what is that, Silas, you like to say? Future proofing.
Future proofing, yes.
Right? Future proofing.
Yeah.
So, not giving you a product that's not going to benefit you if you need something more aggressive in 3 or 6 months, right? Because now you have it already and it can just do what you need it to do. So, those are the things that you should ask when you're dealing with companies, right? And so that's what we just wanted to share on here today. And so I'm going to have Silas to go ahead and share his screen so that he can show us what the standard basic beds that the insurance covers and the other ones that they do not cover but have been a blessing to many families.
Yeah, so I already can you see my screen right now?
I can.
Okay, perfect. So this is once again, this is our website. So you guys can go into our website and you can actually to way to get to this page. So this is the home page here. So if you click Explore Advanced Equipment, it'll take you to this is our pretty much our main key products. So you want to click is hospital beds because this is the page for like basically showing all the beds that for me with all the beds that I deal with. And so this right here is how you get to this page, right? And so it's pretty much a full line of just information, features, use cases, things like that. So first I want to talk about the basic bed, which we were talking about with what's going to be covered by the insurance. So essentially of you this one right here is your basic brown bed here. So it's going to take you straight to that section of the page and so this is the semi-electric hospital bed right here. So when the doctor says that you need a hospital bed and you're about to be discharged, or you're recovering from a surgery, right? And the doctor says you need a hospital bed, this is what he's talking about. Now, of course, sometimes people out there they believe that they're going to get the bed that they were in the hospital, like those high end ones that they were using in a hospital. So unfortunately, it's a full step down from that level of bed to this bed here. Now, of course, like going back to what you were talking about with the deck, you can just tell that this is just a basic deck, right? This is a basic surface. So it's once again, it's only really designed for those who are in temporary use and while they're using it, they're not spending a lot of time in the bed. They're pretty much just using it for positioning while they're sleeping, and then they may take a couple hours throughout the day, but they're mostly in and out the bed a lot, and that's what this bed is really designed for. So you can tell here, of course, you have your railing here. You have, the frame. You do have your traditional head and leg elevation for those adjustments. And then, of course, on here, there's a crank right here. You can see this little knob here. And what will happen is that if you want this bed frame to rise up, for example, if you need the bed to be positioned in a way where it's easy for you to exit or enter the bed, then you would actually have to crank the bed at the foot. You have to turn the crank, and then the bed will slowly rise off the ground. Now,
Right.
the
Can you
issue with
show us
that,
that? Can you go to the video so you can actually show the people, show them with the video what it does so that people can actually
so
see it.
this right here is well, this is the full electric bed. I don't have a video of the
At
cranking,
least they can see what
but
it does.
this is what like a basic full electric bed is. So you can see that
Without the
how.
remote control raising this though. So just so you understand that out there that okay, so what he's doing here, he's actually raising the bed to low. So that's low as it goes, right? So if you have a fall risk patient, you see how that's the lowest that this bed will go. So if you have a loved one that is a fall risk or have some memory issues going on and they're falling out the bed, then this is too far to fall down, right? If you can see it right there. So now he's showing the video where the bed is raising up high, okay? Now that is he's raising that up with the remote control. That's the full electric that I was telling you guys about, right? That is what you can ask your provider who's providing you the semi-electric if they will, if you could pay for the
Upgrade to a full
upgrade.
electric. Yeah.
Right. So then you see right there, that's the head going up. And then, of course, you have the bottom. And that pad that's on there, you guys, that's an alternating pressure pad. That does not come with the bed. That foam mattress that you see comes with it. The alternating pressure pad is something that, of course, if your doctor writes for and if the insurance based on medical necessity, you can get, an alternating pressure pad too to go on the bed. But as you see, you see how it goes up and Silas, let the bed go high up so they can actually see the elevation of the bed as well.
Yeah, so it actually showed that.
Mhm.
It's just going through it. Well, this is a video, so it'll
Yeah.
show the bed going high. Now, once again, this is the full electric bed, so this is the standard full electric. So now, once again, though, this is not covered by the insurance. So as you can see here, this is the high low. This is the frame adjustment. So on the full electric, you can press the button and the bed can adjust a little bit. Now, the only limitation though with the full electric bed is that it doesn't go high enough for easy transfer for caregivers or stand assist, and it doesn't go low enough for fall risk, right? So you can see here. So I'll stop right here. So you can see that there's still a lot of gap between the frame and the ground, right? So if someone's a fall risk and they fall out of this bed right here, it is going to be an actual fall versus, for example. I'll scroll to the top of, let's say, for example, let's say this one right here, you can see a noticeable difference. Now, this is a long-term care bed. This is the bed that we're going to be talking about today, is this long-term care bed here. So you see how low this bed goes, flat to the floor. So this bed is completely, pretty much on the ground, right? And so once again, if you're someone out there, you're dealing with fall risk, you actually will want a long-term care bed, and this is what a long-term care bed looks like. So you can tell that it looks closer to the bed that's used in the hospitals. It actually has the same functionality as the beds in the hospital. It just doesn't have all the extra bells and whistles like the alarm systems and things like that. But as far as the frame positioning, it does have all that. So of course it has, that low bed height,
Hmm.
right? Just another angle, right? You can see that. And so once again, you can see the complete difference, right? There's a huge difference between this right here, this level. So this is a basic full electric bed, how low this one goes, right? This is the lowest that this bed can go. And then you see how low this bed is, right? You can see it's technically on the ground. And here's another thing too. So one of the main advantages with the long-term care bed is, as we're looking at here, is that not only can it go really low to the ground, like pretty much to the floor, but also it goes very high off the ground. So it's really good for stand assist, making it easy to exit the bed and also enter the bed because you can adjust in between. And of course, if you're a caregiver out there, you no longer have to use your back because the bed is going to be literally just as tall as you. And so you can see that here. So you can see how high it's going. right? So you can see how high you can see how high this bed is. And then another thing too is that this bed also not only has the high low with the head and leg adjustment, but also has this frame tilt and recline. So it has Trendelenburg, it has chair position. So this bed right here is showing you this more like this chair position like position
All right, Silence. I think we lost you. So pretty much what he's showing in this video, I think he kind of.
in the bed all if you know you're in a situation where the person is going to be in the bed all day and they're not really getting out, it's very important to have a long-term care bed like this because you're going to have all those extra features. And the features are used for positioning throughout the day. Because if a person's not exiting the bed, they're not getting out and standing up and, taking those breaks, then the bed has to adjust them so that way they can have that proper blood flow, which will reduce the likelihood of fluid buildup in certain areas and also wounds and shearing as well. And that in the wounds and pressure wounds is a huge thing. And essentially, what happens with pressure wounds is that it's created because there's blood being trapped in certain areas of the body, and then there's a breakdown process because all that pressure just sitting there. So with this frame adjustment, as you guys can see, so that, for example, this is a full chair, but this is not a full chair position, but this is a semi-chair position. You can see that the bed is fully, you know, tilted forward, which is really good for just kind of taking a break from that traditional bed position. And of course, you can see here the bed frame is actually reclining back, the whole entire bed frame. So this is really called Trendelenburg here. So this is good for if the doctor says that you have to have your legs above the level of your heart at a certain period of the day, then you actually need a bed like this because this bed is able to tilt you back and have your legs above your heart pretty much. And even with the head being elevated, you can see that because the head section of the frame is pretty much further down, you can just see that you're pretty much reclined all the way back.
That's not a lot.
Yeah, so this is a huge yeah, and once again, the height of the bed. This bed is very high off the ground. So once again, if you're a caregiver, no longer do you have to use your back and kind of deal with that and just all the different things that when it comes to injuries and caregivers throwing their backs out and roll was it shoulder cuff
Mhm.
injuries, things like that. That's pretty much eliminated with these kind of beds. But a lot of times when a person is using they basic bed like this, this will either the semi-electric or even the full electric, because once again, if the person's not having most of their mobility where they can exit on their own and they need a lot more assistance, like, transferring things like that,
Mhm.
the caregiver with these kind of beds have to do more work, right? And so essentially, what these long-term care beds are designed for is to pretty much reduce all that for you.
Right, right. And as I just talk about that, the data, here we go with this data again. It says what the data says about more advanced equipment. Okay, so this would be considered an advanced piece of equipment, right? It's a better bed. It's going to be doing a little bit more. Okay, what changes when the patient is matched to a more advanced bed or support surfaces, right? So take input, better positioning options, better pressure redistribution support, safer height adjustment and transfers. We just talked about that. Less manual strain on the caregiver, less strain on the caregiver, greater chance of comfort and tolerance. And a lot of people, if you think about it, like, what do you like to sleep on, right? Like us as individuals, like, what do we like to sleep on? I know I want a comfortable and a good mattress, and most people do. But I think sometimes when you have a loved one, it seems like people tend to forget about the comfort sometimes that the loved one would need. And it goes back to a lot of times the sleep surfaces, what people are sleeping on, what's going on with them, and why they're constantly having wound issues, right? And shearing and all those things. So all those things have to be taken in consideration when you're deciding on a bed, and definitely the sleep surface, which is the mattress. What type of mattress is your loved one on for that comfort, right? So we talk about in 2022, caregiver focused study on electric medical beds found that caregivers emphasize the importance of functions that reduce effort and improve usability in real care settings, highlighting how bed design affects caregiver experience. That's
Yes.
important. It's
It's
important.
important. Yeah, it's important because once again, it goes back to, like for example, like of course you have the standard full electric bed right here, right? So it has an extra function where instead of you cranking the bed like what you would do in a semi-electric, you can at least elevate the bed frame with a remote. But the only problem is though, is that depending on the situation, it's still not enough for caregivers because the bed's not going high enough off the ground and it's not going low enough to reduce fall risk or even stand assist in some cases as well. So, for example, of course, it can elevate. So I would say when it comes to stand assist, I would say it really depends on how tall the person is,
Mhm.
and also what their mobility is in their legs. So for example, if someone really can't put a lot of pressure on their knees and hips to stand up, then having that more advanced bed is going to make it a lot easier because the bed will stand them up essentially. And for example, I actually have a video I can show you right now. I'll go to that. Go to let me go to let's see here.
And then while you're
So
finding that side, I'll read some more data here. It talks about in 2023.
So right here, so I can show you this. So this is a video. So this is a perfect example of a bed, like according to what the statistics said, right? Like, caregivers wanting a bed that can pretty much do everything for them, or
Okay.
at least take it from, okay, I'm doing like the caregiver's doing 80 to 90% of the work. The bed is doing 90 to like let's say 85 to 90% of the work, right? It's depending on the situation. So for example, when it comes to stances and exiting the bed, for example, this is one of our advanced beds, the rotation bed. The rotation bed is amazing because it literally does do everything. Like the only thing it doesn't do is it doesn't go low enough for fall risk, but everything else it does. So when it comes to exiting the bed, entering the bed, having a chair position, transfers, things like that, it's really good. It's just that if someone's a severe fall risk and they're kind of prone to rolling out the bed overnight, it's still just a little bit too high off the ground. But outside of that, that's the only thing that it doesn't do. But for example, this is a clear video right here. If you can see, if you can you see the video?
Can. Mm-hmm.
Okay, so this is just showing you so once again, so you see here, he's in the chair. Now, of course, this bed allows you to be in a full chair position. So essentially, the bed turns into a full chair. So I always say it's pretty much a combination of a reclining lift chair and in that blue bed that I showed you guys earlier, it's a combination of those two beds put together, and this is what you get. So you can see the bed literally stood him up. You see that?
Yeah.
So I'll show that one more time so you can see how. So once again, the bed literally, you can see the bed's rising off the ground
Mhm.
and it's literally standing him up. So he's not, wow. So, just look at that's impressive, right? So once again, going back to having advanced systems that can really help you.
Mhm.
Now, I have some statistics on, for example, from AARP,
Okay.
because one of the things that, for example, okay, we see all these different features, but the biggest barrier is the price tag. And that's where, you see the rubber meets the road for a lot of this stuff is why people can't get some high level beds, even though they know they exist. It's just that some of these price tags on these beds are really expensive. So for example, like the bed we're looking at here, the rotation bed, it starts at you're looking at around, I mean, depending on what model you get, because this bed comes in three models. So you have the deluxe rotation bed version. That's like if somebody wanted a full bed, a full residential bed frame, but with all that full functionality that's layered under it, then you can get this one right here starts like around 12,000 and goes up to like $25,000. So it kind of it's pretty much an investment at that point. The standard version, which is more of the version where people can kind of settle with because you have all that functionality, may not have the full residential bed frame for style, but if your focus is I want something that can really just do a little bit of everything,
Mhm.
then the standard rotation bed model is really good. And then for those who really just they don't really need the bed to stand them up and things like that. They don't need all those extra clinical positions. Then the fixed version is really good. It's just that the bed frame doesn't elevate
Okay. So basically, what he's saying is that I think he's stuck again with the system or something. But
or we're looking at for this kind of bed.
yeah, I think we have a delay going on, Silas, on the the
Can you
system.
guys hear me?
Yeah, I can hear you. It's like you kind of go in and out, but it's okay.
Oh, okay. Yeah. So essentially, and so for example, like these kind of beds, they're up there, right? They're up there in price, but primarily because they're doing a lot of different high level things though. So it's like you're pretty much taking a clinical bed that you would normally use in a hospital or a clinic, and you're taking that all that functionality, you're being able to have access to that 24/7 in your home, in the comfort of your own home. So you don't have to go to a facility per se, just depending on what's going on. You don't have to go to a facility and spend about 5,000 a month, 4,000, $10,000 a month because you basically have a system that it's a one-time payment. On one side, it's a one-time payment, and you're able to pretty much save a lot of money in the future. So, for example, according to ARP, in-home care can exceed 4,000 per month. With many families paying 3,500 to over $6,000 per month, depending on the level of support needed. As care needs increase, these costs can rise significantly, especially when more hands-on assistance is required. So essentially what it's saying is that, for example, facilities is not a cheaper option either. So for example, if someone has to go to a facility, it can be really expensive because you're looking at around, like I said, for some of these facilities, assisted living facilities can get up to like $10,000 a month. And of course, because based on what the level of care that's needed, right? If it's 24/7 care, things like that, you have to pay that. And on top of that, a lot of facilities don't provide equipment also. So that's a huge thing also. So when you do go for like let's say assisted living, most of them don't offer like, equipment that's already there. So they won't have a bed like this waiting on you, right? You would actually have to invest that money yourself. So when you kind of look at all that, it gets really expensive, the facility side and, multiple having like, some people have like a rotation of caregivers and they're paying even they're at home, but because they have so many caregivers, they're basically paying facility prices like $5,000 to $10,000 a month because each caregiver is like $400 or $500, so what I would say is when it comes to the price tag, you really want to it's really important that if you get the right equipment, you save a lot of money in the long run. Now, even though that some of these beds, like I said, are very expensive up front, if you look at the bigger picture as far as okay, well, on one end, you're endlessly spending $4,000 or $5,000 continuously. Well, by the fifth month, you've already pretty much bought a rotation bed at that point. And
Yeah.
with a rotation bed or a bed like the rotation bed, it may be a lot up front, but you think about, okay, well, how much money am I going to save later on? Okay, well, I spend this one time and this bed's going to last me for 10, 15, even 20 years if you keep, if you take care of it. These beds last for a long time. So some of these beds last for like 20 years.
Yeah.
These level of beds, now not the basic brown ones, but beds like the rotation bed, they're built to really, of course, if you take good care of them, right, they can last for a very long time for you. So what happens is that on one end, let's say you make that investment and you're able to save a lot of money in the long run, and the person doesn't have to go to a facility. You don't have to spend extra money on caregivers because the bed is pretty much doing everything for them. Or instead of you having 7, 10 caregivers, you only have one or two, right? And so just look at that whole picture, you can kind of see that you if you look at the bigger picture, you save a lot of money with these beds, but there is differences. So I always say is if you guys are listening, is that what you want to do is first you want to look at the situation that you're in. If you know that you're in a very temporary situation, then yeah, for self, you don't invest in anything like this. But if you're in a situation where it is something long term and it's like, okay, yeah, like I may have to make it some heavy investments. It's really just better just to get the right equipment
Yeah.
because when you get the right equipment, the equipment lasts for a long time and it's a one-time payment versus paying multiple caregivers and facilities, things like that, and you're spending endless amount of money, endless, like literally, yeah. Some of these prices go is up there.
Yeah. So and then to piggyback off what Silas is saying too, like you look at these beds here, and these are expensive ones, but some of the ones that he showed earlier, they're like around $5,000, like the one that you see behind the rotation bed. So when you talk about pricing and when you talk about what the bed is doing and the functionality, if you go to the retractor bed, I give you an example. So I'll show the retractor bed.
So yeah, this is the retractor bed here. So once
Oh,
again, this bed is not as expensive. So there's levels, right? And so like what Tara's saying is there's levels to the level of care that you will want, right? So of course the rotation bed and beds like that, that's for this somebody who says that I want this bed to do everything, right? I want this bed to do literally 90% and offload all the work for me. And of course, based on the situation, right? If somebody needs that heavy assistance, right? If someone's more somewhere in the mid, they're not in basic hospital bed territory, right? Where they're fully mobile and everything like that, but they do have okay, they do tend to roll out of bed every now and then, or they need something that can kind of just help them get in and out. Then you have beds like the retractor bed that are, you know, solid, not as expensive, right? Still gets the job done, not as expensive, but just right.
Right. And with that, so when you think about and you do the calculations on, so you're thinking, well, if this bed can help my loved one stand up, well, you maybe have two caregivers now. Now you may be able to have one caregiver, just depending on, again, what's going on with your loved ones, because you want to make sure of all that. And then also, that's why the clinical product clinical assessment is so critical, because you have someone can find out what's going on with your full picture and then see how that can, how you can work that out, right? Because the functionality, you'd be surprised, and we've seen it. We've seen
Yeah.
it real time on how people have brought in the right equipment. So, an example, one of these beds here and a chair, and they've solved a lot of their problems. And then when I say solve their problem, in other words, they don't have to have two caregivers to take care of their loved ones because the equipment is so powerful. Now they maybe need one caregiver. And instead of those two caregivers being in there at the home, you can
You need
split the
one.
time. Maybe they're there for 6 hours or 8 hours, and the other one comes because the equipment is doing a lot of the work. And not only
Yeah.
that, when you think about labor and the injuries that go on when it comes to caretaking, it is the number one injury related injuries in the United States when it comes to injuries for caregivers. They hire labor in the labor market, right? Because of the lifting and the pulling and pushing. But when you have the right equipment, then a lot of that doesn't happen because the bed is right there with you. Literally, it's right there. Like it's taller than you almost sometimes, depending on how tall you are, right? But we've seen it and it's a game changer. We've seen caregiver, and let me say this too. If you have a caregiver out there and you invest in one of these type of beds, more an advanced bed, and they're intimidated or they're, fearful, or, oh, it's not working, all these things, it's not that it's not working, it's because they don't know how to use it properly. So that's another thing. Training, education is so critical. It's so important. When you purchase these advanced products, you need to make sure that whoever you purchase them from, that they are able to train your caregivers or your staff if you're a facility, okay, and show you how to position the bed properly, how to adjust the bed properly. All those things go into play to make sure that you're going to get the best out of it. So for you guys out there who are looking to purchase any type of equipment, whether it be a bed or chair, what have you, make sure that they know how to adjust it and use it properly so that your loved one can get the best experience from it. And also too, if a caregiver does not know how to work it or use it, it could be detrimental to them. When I say detrimental, they could hurt themselves because they don't know what they're doing. So it's very important that the training and education is there. Okay.
Yeah, and also I would like to add that to that too, because once again, everything has a learning curve, right? And so it's almost like even, using a smartphone. If you have someone who's used to using a flip phone,
Mm.
they're used to analog buttons and things like that, and then you
Yeah.
switch over to the smartphone, and the smartphone it's amazing. It has all these features. It can do this, it can do that. Touch screen, right? There's no more manual analog buttons anymore. You just have a glass touch screen that you can just press it and it does things for you, automated. Even if you don't even though it has all these features, it can still be intimidating because it's such a switch, right? So same thing with these beds. Of course, with a basic, semi-electric bed or a full electric bed, you may only have maybe a max of 4 or 5 buttons. maybe six. But then when you start getting to beds like these, the beds like the retractable, or I'll just say long-term care beds, they may have eight or sometimes 12 buttons on the remote, right? So it's just like a regular TV remote, right? So there's a lot of similarities. This kind of just comes down to everything has a learning curve. So you have someone who, once again, going back to the phone example, someone's using a flip phone and they switch over to a smartphone. Oftentimes you hear, "Oh, this phone is not good. It's doing all these things.
Yeah.
It's crazy." But the truth is that no, it's not the smartphone. The smartphone has been proven. It's a really good machine. It's just that you haven't unlocked on how to use it properly, right? So
True.
once you may have to get a consultation, right? So I know, for example, Apple, they have Genius bars. You can go to the Apple store and,
Yeah. Okay,
you can get
Silas, the
your
Genius
Genius
bar.
bar. And then
Uh-huh.
at the Genius bar, right? Or you can probably take a class, how to use a smartphone,
That's
right?
true. They do have those, huh?
Have those, right? So if you
Yeah.
go to the Genius bar, you can say, look, I'm having issues. This is an amazing phone. I just don't know how to unlock it properly. I don't know how to unlock the features. How do I make this machine, all these features work for me? They'll
Mhm.
tell you how to use it. Okay, do this, do that. When you see this, this is what this means. That's what that means, right? And
Yeah.
then next thing you know, let's say after you maybe a couple sessions, now all of a sudden the phone goes from, oh, this thing is not working, this is crazy, to, oh, this thing's amazing. It's a
Yeah.
superpower,
So
right?
true.
It's the
That's
same
a good
thing.
analogy, Silas. That is really
No,
good.
it's the same thing. And so it's, for example, like
Same
I
thing
have,
for a car, y'all, too. Let's think about that out there. You get these
yeah,
cars sometimes. I know I'm guilty. I'm guilty. I
yeah, like
literally had a car for a long time, and then I'd be like, I didn't even know it's self-drive.
yeah,
Yeah,
right. So,
yeah, all
right,
that stuff.
because what has happened, right? The
Yeah,
cars, maybe in the early 2000s, are more analog. It was more manual type features, right? Then it's 2026, cars are now driving themselves.
yeah,
So, what does
yeah,
that mean? That means that more features. Now, does that mean, well, because the market has demanded, no, I want more. I wish this can do this. I wish it could do that. So the manufacturers, they hear that and they say, okay, well, let's add those features.
yeah.
And once it goes to the market and the person finally gets those features, they probably they complain in the beginning. That's because they just don't know how to use it, right? So just the same thing with the car, same thing with laptops. Smartphones is the biggest one because if you, like I said, if you're using a flip phone and you go to using a smartphone, it's a polar opposite, right? And so it's the same thing, right? And so even down to, like, I had one client, they got a lift chair, right? And so the lift chair, it was one of those it was a high-end lift chair. So it had a lot of these same features that the bed has, right? Trendelenburg, recline, all these different things. So on the remote, it was like about 12 different buttons on the remote. But when you really think about it, it's the same thing with a TV remote. When you look at a traditional TV remote, there's about 30 buttons on there almost, right? So it's the same thing. And over time, because you're using it every day, it's not a big barrier because you're using it every day and you get familiar with the buttons. So it's the same thing. So anything brand new looks intimidating, but after a while, once you get used to get more familiar with it, then it said, "Oh yeah, this thing is amazing. It's great, and it's doing everything for me because you have unlocked how to use it." Right. So I would say it's the same thing with the beds. The beds are amazing. They made these beds because people have complained about, I wish it had this feature. I wish the bed can do this. I wish it can do that. So the manufacturers, they hear that and they say, okay, well, let's come up with a solution to that problem to solve that problem, right?
Right.
Now and then of course you put that kind of bed in front of them, and then in the beginning it's a lot, but then once you have somebody that actually teaches you how to use the bed, this is what this button does, that's what that button does. Now all of a sudden, oh, now everything has been unlocked.
Great now.
So and
It
also,
goes back, Silas, too, just to just kind of jump in real quick.
yeah,
It goes back to understanding and making sure that wherever you purchase from, that they're able to train you. And what does that mean? It means that they're not going to just sell you something because of the specs and all that. They need to understand and be able to tell you what it does, how it can clinically help you, right?
yeah,
How can it clinically help you? I don't need, not just, oh, it's doing this, it's doing that. No, how can it help me clinically? Will the clinical contour help me based on what I have going on? Does it have a clinical contour
that's
to
right,
it?
yeah.
Does it have a Trendelenburg? I may need to elevate my feet above my heart. Does it do that? So do they know what the Trendelenburg? I mean, all these things that you have to ask yourself. That's why it's so important that when you get ready to buy this equipment, that you speak to specialists, people who specialize and study this product and understand how this product functions. Okay, the functionality of it clinic and how it comes together clinically for you. So that is so important. And so, Silas, before we wrap up, what is your last words that you want to share with someone tonight so that they can have a better understanding? You kind of pretty much laid everything out. Okay. Oh, Silas, go back for a second. I want to show you guys something really quick. We talk about the deck. Okay, go back up, Silas, to that picture, the other one that had the retractor was kind of a bare. The deck was bare. Okay, so that you see the opening there. When they talk about the deck,
Oh yeah,
and
the openings here, like
right,
there's a lot of it's like a wire type frame,
yes,
but it's good because, for
open.
example, it's open, right? And so that's what, and the whole purpose of this is going back to what you said in the beginning of this episode about low air loss mattresses, right? And so for
Another
those of
episode.
you there, I'm going to show you what a low air loss mattress is. So for, because, if you haven't seen one, so I'll go to a low air loss mattress and I'll show you guys what that is. It's essentially it's a mattress, but it has, um,
Air
feet
sac.
air cells and a pump. So this is what a low air loss mattress is right here. So this, for example, this is a low air loss mattress, right? And so you can see these air cells right here. These are all air cells and bladders. You have this pump here at the foot of the bed, right? And so once again, there's an air tube that's pumping air through the system. And essentially, where the low air loss is made for helping heal wounds and help reduce and prevent them as well. So now, of course, in the realm of low air loss mattresses, there's different levels.
Yes.
So, for example, for someone who's, let's say, let's say if they're diabetic and they have underlying conditions that make them more prone to getting wounds and sores because they're stationary in a bed, then they would need a more advanced lower air loss mattress, right? Because once again, there's levels to within these mattresses, there's levels, right? And so the answer now, of course, with insurance does pay for a low air loss mattress, but then going back to just like the question with beds, what kind of low air loss mattress are they going to pay for? Well, one of the main criteria is for someone to get a low air loss mattress is they have to be at a stage 3 or stage 4 pressure ulcer or wound, right? Which is kind of insane, which is kind of interesting because once someone gets to stage 3 or 4, they're basically, it's like a hole in their leg or in the skin, so that can be very painful. So I don't know why they will wait that long, but even then, most likely you're not going to get a advanced low air loss mattress, and primarily because it goes back to what you said about the reimbursement rates and some of the just the number the allowed amounts of what they cover. So a lot of times the more advanced mattress. So for example, this is a Domus 3, so this is kind of like your entry level, basic low air loss mattress that's very good. But then if someone's at stage 3 or 4, or they're at high risk of getting that, you want to prevent it, then that's when you start getting into like a long-term care. So like pro care, like these level mattresses have extra features to them, right? So you can see that even the panel here has more buttons on it. You can tell that this is looking a little bit more aggressive than the other one. So once again, there's levels too, just based on what the situation is. But this is what a low air loss mattress is, just for those of you who have not seen a low air loss mattress. Like, you've heard of it, but you've never really seen it. This is what they're talking about, right? And also another thing too, I want to add is that a low air loss mattress is not an alternating pressure pad. So because that's another thing a lot of people get confused about. So this is the alternating pressure pad. And so alternating pressure pad does alternate to help, with pressure, but it's a topper over a basic foam mattress, right? So when someone if someone if you ask, let's say you call a company and they say, oh, do you guys have low air loss mattresses, and they bring you this, you may have to respectfully tell them this is not a low air loss mattress.
Right. It is an alternating pressure pad.
That
Yes. Because we have
Yeah. So
people that's very confused about there's a lot of confusion between that and then we hear a lot of, oh, the bed. An alternating pressure pad is not a bed. So just so you know that out there, because I think a lot of times because we hear people, oh, the bed, and we're like, okay, well, you talking about the bed or you talking about the mattress? Oh, the bed. Well, the bed is the bed, right? But then you have your foam mattress and an alternating pressure pad, which you see right here in the picture. It sits on top of the mattress, okay? Then, let's go take them to the low air loss mattress again. I'm going to show you something. But so basically, you see that that is a full on mattress and a low air loss mattress in one. So what happens is that the your regular foam mattress is removed from the frame deck, and then this particular the low air loss mattress sits on that. And what we'll do is we'll do an episode talking about the differences in the low air loss mattresses and what to look for when you're getting one for your loved one, right? And you want to get it based on, so if you're having to pay out of pocket, of course, if it's insurance, then you're gonna, you have to get what they give you as far as, depending, of course, what's going on with your loved one and medical necessity and all those things. But normally, if a client, if the provider is going to bring you one out, it's going to be one within reason of the price. Okay, it won't be. So I'll give you an example. When we do clinical assessments, we look at the full picture of what's going on with the patient, and they may be okay with a Domus one or a different brand because we do other brands too sometimes. But if they have, depending on what's going on with them, they may need a Domus 1, they may need a Domus 3 or 4 or more advanced. They have lateral, they have the turning. So there's different levels to low air loss mattresses, and a lot of people don't know that. They're like, what? I thought low air loss is a low air loss. No, it's not. We've had people that be on one low air loss and it really wasn't doing much. But then because we found out what kind of condition they had, we advised them to get more an aggressive type of low air loss, and now they're fine, right?
yes.
So it just depends on what levels that you're at, what's going on with your loved one. Again, a clinical assessment, a product clinical assessment. Do people know everything? Is anything a guarantee? No. But at least you can take the clinical piece of what's going on with the specs and what that particular product can do to accomplish a full on, hopefully, recovery for your loved one, when it comes to those wounds and comfort and all that. And actually, if you look here, you can actually tell the differences. Look at that. And that's an optimal prone. So again, we won't go into it right now, but we'll do another episode and kind of give you guys some data and just show you that, show you more, but more in a, in a strategic way that you can actually see it. And then we can tell you what each one does. And so that will be on our next episode. And so today, we just want to thank you guys for listening and watching on tonight. Again, thank you for tuning in to the medical equipment world and healthcare. Get the scoop.
Yep.
Break down all this great information, and hopefully that you can take something away so things can be just a little bit easier for you out there. This episode is sponsored by CFS Medical Supplies and Equipment and CFS Solutions, your number one consulting place. Anyway, I
Yeah.
just want to throw that in there, you
And
guys.
one more thing I just want to add before we end
Okay.
this episode is that because this is such a great topic, like I can go on and on about this because there's just so many situations I've seen and how things could be avoided. One last thing I will say too is that since you guys know the difference, from for the most part about, we'll make some more episodes. If we have more episodes coming, like we'll do an episode in depth about which each bed is doing. I think that should be our next episode, kind of breaking down specifics, what they're doing and comparisons. We can do that. This episode was more just an overview of what the insurance really covers. So when you have insurance, when you're getting a bed through insurance, you'll know exactly what you're going to get, so you can make a decision. Well, no, I want something more advanced. You just make that decision yourself. And also, I would say when you're looking at buying a bed, it's always good to, I always say, I kind of take this from kind of like in tech when you're buying laptops and things like that. It's something called future proofing. So when you're buying a bed and let's say something, whatever the situation is, if you feel like, or the doctor has said that this is something that can progress and it can get more difficult over time, it's always good to buy or invest in the proper bed up front that does have all the features that's needed. So that way, even in the future and things go south, you don't have to panic and say, "Oh, I now have to buy another bed now." That bed already has those features wrapped in it, right? Even if you don't access them, just like, smartphones, laptops, things like that, they have features that you don't use. Even cars, there's features in a car that you don't use, right? But it's there if you ever need it. So that's just another thing I want to put out there, is that when you're in making the investment into these type of bed systems, it's really important to kind of make sure that the bed will have a feature that help you today, but also help you in the future. So that way you don't have to buy a second and third bed.
That's a good, Silas. That's really good. Okay, you guys out there, that's great information, Silas. And that's good. So future proof your products, right? Get things that you know that can last you. You don't have to worry about going back and forth. We see this all the time. And what, for us and why we're doing this is because we see it like real time. This is not us getting on here trying to be like, oh, it's a thought or we think. No, this is stuff we see every single day, you guys. Like every day, there's so many different stories and
It
people in
was
this industry. I know if you're in this industry, you know it too. Like you see how challenging it is for families, and it's really heartbreaking because when you know what's out there, we get a lot of families. It's like we know this could be so much better for them to help them out, but it's like, some of the stuff is expensive, it really is. And but we kind of try to give people tips and things to kind of help them navigate a little bit, if that makes sense. That even though they may cannot afford a particular item, to try to give them some tips on things that they can do to kind of help them out. So we just try to be a source for people. Actually, I forgot to tell you, but we have an app, and if you go under Google or Apple, you actually can download the app. It is a free app. And we created the app because we wanted to be able to give resources to people where if you're in a situation or you need to try to figure something out with equipment, that there's blogs on there and that we've interviewed other people. There's links to access those people, like for billing. If you had questions about, you got an explanation of benefit and it's maybe higher than you were expecting, there are people we've interviewed that specialize in those things and all kind of different stuff. You just download the app and just kind of look through it and whatever. It is a growing app, so there's some things on there, but it's more things being added. It's also some how-to videos on there. They're constantly being added. So we're constantly adding things and updating things and just trying to give people information and resources. So if you're out there, take us with you. Download the app. And I think it has a chat feature too, right, Silas, that you can actually send a question in sometimes if you have one. I'm
Yeah,
not quite
that's
sure if
no,
that one.
yeah, no, the app doesn't have like an AI or
Yeah, I
anything like
think.
that. It's more like you can,
And
I believe it has like where you can contact, and then you can just there's like I guess it's a form chat that you can do where you can just type something in, and then
yeah.
and you can actually communicate with other people and things like that on the app. But they haven't added the feature as far as like AI just yet.
Okay, but the app has been great for people who have utilized it and was able to grab information off of it, or just was looking for something about some particular thing, whatever you're looking for. You can go on there. It might be on there, might not, but you never know till you try. It's free, right? So go on there, look on there. Also, too, we're trying to add videos on there to show you how to properly like transfer someone. What is a good setup, right, for your home? Just things like that. And so we do like home modifications. We specialize in ramps and all those type of things, also elevators and all that. So we have a lot of different things that goes on to try to help people just kind of maybe navigate their home and make things a little bit better in their home, ADA compliant and all those type of things. And we work with a lot of different people. So just know that yeah, we have there's a lot of great information out there on that app that can kind of help people.
Yeah, and once again, my last thing I'll say is stay tuned for the next episode. Once again, these episodes are more for information because one of the main things that we see a lot is every day is that most of the mistakes are just happening because no one knew, right? No one, the doctors, they don't know, and primarily because their job is studying eternal medicine, right? So they are not taught about medical equipment, right? And medical equipment is, I would say, is a topic that is really not talked about at all.
It
So
is.
it's only one of those things where you only learn about medical equipment unless you have went through unless you had an injury, a significant injury where you're going to be down for a week or two. And then in some cases, when there's certain medical conditions that just flare up, where now some of your mobility is being taken away and things like that, that's the only time you'll actually hear about the medical equipment. And by then everything is moving so fast, so it's very likely that mistakes do happen because you're trying to figure things out, you're trying to solve problems really fast. And so because no one's really out there um really kind of talking about what's really out there, I don't think that's why a lot of mistakes and
Breaking it down. I think that's one of the things, Silas, where we talk about breaking things down. So like what we find too, and because a lot of times we'll have patients and customers will say like, "Oh, I got this prescription. Well, why didn't my doctor tell me?" Well, the doctors they
don't
don't know
know.
equipment. Now, the basic beds, the basic wheelchairs, basic walkers. Yes, they all know about. But the thing of it is that you'd be surprised because even occupational therapists. I've had occupational therapists, physical therapists, ADPs, ATPs tell me like, "Oh my God, I've never even seen a rotation bed. I didn't even know that was out there." So but that's not what they do, right? They are great at what they do, but they
Mhm.
don't keep up with what all this new equipment that's out here. They couldn't because they don't. That's not what they do. We're in the medical equipment realm, so basically they have their specialty and we have our specialty, and this is our specialty, right? Understanding equipment, knowing what equipment is out there. Now, do we know every product that's out there? No, but what we do know is that the best we try to do the most innovative products with the best quality. That's the difference too. Quality. You want quality products, okay? Just because it's cheaper doesn't mean it's gonna last. Because you gotta remember, you're using this. This is your health, right? So you want to make sure whatever you get that the quality is there, that it's not going to break on you. We've had people walkers break on people. We're like, oh my God, like really? Well, it was cheap. There's a reason why if you see a walker and it's $50, you might want to question it. And I'm talking about a rollator. I'm not talking about a front wheel walker. You can get a front wheel walker for maybe 40, $50, depending on where you get it, right? But when you see a rollator or you see something that's really, really cheap, and then you see other prices that's a little bit elevated, and you maybe like you got three companies that got a chair that a rollator that's all at $100, $100, $100, $100, and you got this one over here for 50. You might want to question it. You might want to pause and say, wait a minute now, why are these other ones this price and this one is $50? Right there, I mean, just you really have to think about these things, right? Now of course if it's used or something that might be, but if it's new and it's lower like that, you might want to question it. So again, this is just resources and information and just trying to share things to make things just a little bit more easier and bearable for you. Okay, so again, you guys, thank you all for listening in, and we'll see you on the next episode.